How well do you feel like you know your own breasts? How frequently have you touched your breasts? How regularly do you check to feel for changes? This is something I've been thinking about a lot because in my practice, I notice that so many people struggle to touch their own breasts, move their own breasts, shift them around as needed, especially in the beginning. And after years of breastfeeding, I now feel very comfortable with my own mammary tissue. But I could not say that I was comfortable with my breasts before I was a lactating parent. Today, we have such a special treat. We get to talk to somebody who is both a lactation educator and an expert in breast imaging. She went to graduate school to become a registered radiologist assistant, which is equivalent to, say, a physician's assistant. Many of us have PAs as our primary care providers or providing some sort of care, and that is the equivalent in radiology land. So enjoy this conversation with Courtney. I hope that you learned as much as I did from this enlightening conversation. Have you ever stopped to consider why so many humans struggle to feed human milk to their human babies in recent history? Have you then looked around and noticed that so few animals in the animal kingdom struggle to do the same? My name is Lo Nigrash. I am an internationally board-certified lactation consultant, or an IBCLC, and a childbirth educator, and I have been thinking about this for a long time. Come uncover the barriers that make feeding our babies so difficult through conversations with people who have breastfed and pumped, through evidence-based information around breastfeeding and pumping and human milk making, and through conversations with other experts in the field. So that one podcast episode at a time, we chip away at these barriers and make breastfeeding easier for everyone. Hi, Courtney. Welcome back to the Milk Making Minutes.
Hi, thank you so much for having me. I'm very excited to be here.
So you already told your baby feeding stories, 3 of them, and they were really great. 2 smooth ones.
Yes.
And then 1 kind of bumpy one, but all worked out in the end.
Yes.
And our listeners can go back the same week that this is airing on a Thursday. They can go back to the Monday episode and listen. But I'm having you back because you have a very unique expertise. And I wanted to bring you on to share your perspective given your unique expertise. So why don't you tell us all of your credentials and then we can get into the topic.
Sure. So my name is Courtney Yeager. For those who haven't listened to the previous episode yet, I am a registered radiologist assistant. I am also a certified navigator in breast imaging. And after having my first son in particular, I became a certificated lactation educator counselor. So I also have a specialty in lactation education as well.
Yeah, what a great combination to have both the imaging expertise and the lactation education expertise.
Yes.
That's a really great combo.
Something I'm very passionate about.
Yeah, I don't know if I know anybody. Do you know anybody else who does both?
I don't.
Yeah.
I would love to meet them if you're out there.
Yeah.
For me, it was going through my training in radiology and specifically in breast imaging. Breast cancer screening and breastfeeding are so very different, but at the same time, there's the same anxieties there. There's the same need for support. And of course, it all relates back to breast health. And there's just that continuum there. The same women and families who may be breastfeeding eventually at some point are going to go for breast cancer screening or their mammogram. And it's a continued conversation. So I love being able to be there to support and help educate through that whole process.
Yes. So you provide full spectrum care for anybody who has mammary tissue. Is that right?
Yes, and they're a little bit separated. I work in a hospital as an RA, specifically under the supervision of a radiologist. So in the radiology department, we're seeing women who are coming in for breast cancer screening, of course, and then also anybody who feels a lump in their breast or their doctor feels something and they need to have some diagnostic imaging. We are seeing those women in the imaging department. And then as a lactation educator in a private practice, I provide support and education for lactation.
Yes. And included in what you might see as an RA are people who might have abscesses or plugged ducts or
Mm-hmm.
recurring instances of mastitis and need to
Yes.
have imaging to
Mm-hmm.
determine what are the next steps if this continues to happen. Is that right?
Exactly. Yep. Even women with cysts or that may ultimately need a drainage or a biopsy, they're seen in that department, in the radiology department as well.
Okay. Okay.
Yeah.
Very good.
Yeah.
Let's just start with the anatomy of the breast. Like when
Mm-hmm.
you look at a healthy breast on in imaging,
Mm-hmm.
what is it that you are looking for when you are looking to see just a healthy breast, both one that is not lactating and then one that is lactating?
Sure. So if you think of a classic mammogram image, you're going to see a lot of black and white. And all people with breasts, all women have naturally in their breasts fatty tissue and dense glandular tissue. The dense glandular tissue is going to show up as white, and the fatty tissue is going to show up as black. And that's what gives you that variation of black and white colors on the image. And the radiologist in particular is reading all of this as the images are acquired. So you can see the breast tissue and also you can see the nipple and the muscles behind the breast as well. Now, the interesting thing about the breast tissue is just like a fingerprint, we're all very different. Your breast tissue, everybody's breast tissue is a little bit different. So some people have naturally more dense tissue, more glandular tissue. Their images are going to be more white. And some women have naturally more fatty tissue. It has nothing to do with weight. It's just how the breast tissue is made up, and their images are going to be a little bit more black. So there's that variation that everybody's different. And if you have dense tissue, it can make it a little bit harder to see, specifically on the mammogram. So that's where knowing this information when you go to have a mammogram, that's when that would be determined. Could indicate that you might need additional imaging with ultrasound or MRI to help see through that dense tissue. So that's the baseline for the normal breast tissue. Things that we look for, the radiologists look for on the images are any areas we can see calcifications in there. They might show up any areas of increased density that might look a little bit different on that side of the breast or compared to the other side. Those are going to be indicators that maybe there might need to be some additional imaging in that area to see what's going on.
Okay. And so that's just for a non-lactating breast.
Correct.
Can you see the milk ducts in a non-lactating breast in imaging?
You can see them often on ultrasound very well.
On an ultrasound.
Mm-hmm,
Okay.
mm-hmm.
All right. And then when a person begins lactating, how does that imaging change, or does it?
It does. So typically when a person is lactating, the breast tissue is inherently, no matter what your breast density is, going to become more dense. So it's going to be harder to see on the image. It's going to be more white overall during lactation. That doesn't prevent, that's not a contraindication for having imaging. You can certainly have imaging, and sometimes it's very important that you do have imaging. But that's what that change would look like, would be that it would be an increased density on the mammogram specifically.
And what is creating that increased density?
Yes, that's a great question. The milk ducts, the engorgement of the milk ducts, depending on how early on in the breastfeeding journey, some inflammation of the tissues, all of that is going to increase the density there.
Okay, so we now know that when engorgement happens, it is not just from milk, but it's also from extra blood and lymph coming to
Exactly.
the area. So is that what that increased density is
That all,
from, all the extra fluids coming to the area?
that all comes into play for sure.
Okay. So if somebody needed imaging for some reason, would it make sense to do lymphatic massage or something like that before the imaging to try to clear out some of the extra lymph and blood that comes to the area in order to make it easier to see in the imaging?
I love that idea. That is a really great thought. And yes, I don't know all that much about lymphatic drainage. That's something I want to learn more about, but that is definitely something that could help. What we typically tell patients and clients to help reduce the density on the images when you are lactating is to feed the baby or pump as close to the appointment as possible. And that will help to reduce that density.
Okay. All
But
right.
lymphatic drainage would also be a really interesting idea as well.
Coming up, I'm going to continue this conversation with Courtney, and we're going to talk about self exams, variation in breast shape and size, what to look out for that might indicate a problem with lactation when you think about shape and size, and what contributes to higher rates of breast cancer. But before we do, I would like you to listen to a quick ad from my sponsor, Feast and Fettle. When you support my sponsor, you're supporting me. You're allowing me to continue to do this work, to share stories of a variety of baby feeding situations, and share my own expertise and the expertise of others. You've heard me now for a few months talking about how much I've enjoyed getting home cooked meals delivered right to my front door from feastandfettle.com. And I'm here today to tell you that if you know somebody who is in the postpartum period, who you would like to provide true support to, that you should go to feastandfettle.com and order home cooked meals to be delivered right to their front door. One of the biggest barriers to breastfeeding success is a lack of support. A new parent is feeding a baby up to 15 times a day. How on earth do we expect that person to feed that baby that many times, also feed themselves, and provide meals to other members of their family? There's not enough time. You know how hard it is as a busy parent yourself. Go to feastandfettle.com, use my code MILK, MILK, coordinate which meals they would like to have delivered, and be the person who eases the burden for them. What a gift. Okay, and we know that people should be doing self-exams to feel for any abnormalities, anything that feels different, and then call their provider to go in for testing if anything feels hard or areas that feel like a little lump or something. That is sometimes hard to do during lactation.
Yes, it is. It is. And it's interesting. The whole concept of breast self-exam is a hot topic right now. There are conflicting recommendations about it. But the takeaway, the important thing to know is that what is recommended across the board and is so important is the awareness of your breasts. The monthly self-checks, you can do it every month on the 1st if that's when you want to do it. Or if it's just the constant routine or ritual of when you're in the shower, just feeling your breasts and knowing what's normal, knowing what the baseline is, whether you're pregnant or not, so that when you do become pregnant, or if you already are pregnant, just knowing what feels normal for you, so that when you notice any changes in, like you said, feeling a lump or skin discolorations or something just feels off, there's a focal point of pain. Those are all things to notice, see how it feels, and talk to your doctor about for sure.
I notice when somebody has a lot of unfamiliarity with touching their own breasts. And before I breastfed my first child, I did too. But culturally, our breasts are taboo, that we haven't really been taught to touch them. We're told to cover them up. They are this sexualized part of our bodies.
Yeah.
And we're not really told to, it's becoming more of a topic that we talk about, but we're not told to pleasure ourselves as children. It's not something that as girls we're talked about. And so then when I'm doing lactation consults and I'm trying to get people to touch their breasts in certain ways, or even hand expression, which we talked about in your personal story,
Exactly.
People are very awkward holding their own breasts. You can tell they have a lot of unfamiliarity with their own breasts.
Yeah.
And I think this idea of just in the shower, getting to know your breast, touching it, feeling around. And I try to encourage my clients once they are lactating, just poke around, feel the areas where you feel more milky and less milky, because those are going to be the places that you're going to want to touch when your baby is breastfeeding or when you're trying to pump. And the more you touch your breasts, the better off you're going to be when it comes to your milk supply.
Yeah, exactly. Yeah. And the more you're going to know what's normal for you, which is really the important thing. A lot of people don't realize that breast tissue can actually even extend up into the underarm armpit area. So that's also an area in doing this kind of breast self-exam, being aware of your breasts, to include that area as well.
Yeah. And can you talk a little bit about variations we see in some people feel very self-conscious about asymmetry in their breasts or size of their nipples or size of their areolas, but actually because we don't see each other's breasts very regularly, but I know I've seen, I don't know, hundreds, thousands of breasts at this point, and I know that you have too.
Yes.
The variation that we see, the normal variation that we see in the human breasts is so wide ranging. So will you talk a little bit about the normal variation that we see, and then anything that are outliers that might indicate that somebody might have a problem when it comes to lactation?
Yeah, sure. So like you said, there is so much variation with what everybody's breasts look and feel like. Even your own one side can be bigger than the other. One side can produce more milk than the other. And that's very normal. This goes back to what I was talking about earlier on about the image, how everybody is like, their breast tissue is like a fingerprint and everybody is just a little bit different. And that's normal and very common, even going down to nipple size, like you said. Something that I always like to point out too is a lot of people come in for their mammogram, or they come to a lactation consultant and say, I have small breasts, I'm probably not going to be able to produce a lot of milk. And that actually, the size of the breast doesn't determine what your milk supply is going to be. It's actually the amount of glandular tissue within the breast. So I think that's interesting too. Someone with very small breasts can produce a lot of milk and vice versa.
Yeah, exactly. Yeah, so the size of the breast is really determined by how much fatty tissue is there. Is that
Fatty
right?
and glandular tissue combined. Yeah. And
Yeah.
everybody has different variations of that.
Yeah, and then the glandular tissue is essentially the milk ducts, the number of milk ducts. And do those how many milk ducts a person has, can that increase over time? Like it builds. Pregnancy number 1, there might be a certain number, and then pregnancy number 2 that can grow.
Yes. Typically with subsequent pregnancies, the amount of glandular tissue, it's like your breast has a memory. It's going to remember what happened last time and make more to support the new baby. That's typically what happens. Yeah.
Yeah. And then I know that, for instance, there are certain breast shapes that may indicate that there is a hormonal difficulty, like tubular shaped breasts that are very separate, are often associated with PCOS, for instance, and that could be associated with low milk supply.
Yeah, exactly. Yeah, exactly.
Are there any other breast shapes that are associated either with variations in milk supply that you know of, or disease down the line?
Not necessarily variations in size that is coming to mind, but one thing is it's going to be prior any breast surgeries that have happened can affect the supply for sure. That's a big one that comes up a lot.
Yeah, either reductions or implants on either end. Yeah. Or even breast trauma. So like a car accident where the seatbelt dug into the glandular tissue. Can you see that in imaging if there has been any trauma to the breast?
You can, yes. Usually immediately there'll be some bruising that we can often see on ultrasound, but over time those things I was talking about calcifications earlier, these things can calcify, and that can be a reason for a completely benign calcification, meaning that it is not cancer. But often, if it's depending on the level of trauma to the breast, those changes can stay within the breast as well. Same with breast surgery, that the scars you can see that in the breast tissue moving forward as well.
Yeah, or any sort of impact to the chest. I don't want to get too into all the different types of impact, but if anybody has been in any sort of domestic violence situation or anything which they had a lot of trauma to their body, that could create long-lasting impacts on the glandular tissue.
Yeah.
Um,
Yep.
yeah. Okay. All right. And so then when a person is done lactating, they're done with that time in their life.
Mhm.
What is the longest you've ever seen that somebody is able to still get milk out of their breasts? Have you
That is a
seen?
great question. There will be patients and clients that call and out of the blue say, I haven't breastfed for 5 years and I squeezed my breast the other day and milk came out.
Uh-huh.
And I wouldn't say that's like the normal thing necessarily. I don't think that doesn't happen all the time, but it can linger, and it can just be that it is just residual milk in a gland somewhere.
Mm-hmm.
But to that same point, I will take the time to say here, though, that goes back to what we were talking about, any changes in your breast. So if it has been 5 years since you have breastfed and you notice that milk is coming out, that is something to note and talk to your doctor about, these little changes, especially as so much time has gone by that you would want to follow up and just make sure that there's nothing else going on.
Yeah, exactly. Especially if it's coming out and you haven't worked to squeeze it out. I know some people will be like, I wonder if I can get some milk out, and they'll try to
Yes.
squeeze. That's different than, whoa, there's like milk coming out of my nipples.
Yes. Yeah. And the color of it is very indicative as well. Usually, if it's green or milky, that's better than if it was clear or bloody or brown or anything like that.
Oh, okay. So if it's clear or brown or bloody, what would that be signaling in your brain?
That could indicate that there's something going on, and we definitely would want to take a look at that. The first step would be to see your doctor, whether it's a OBGYN or a midwife, primary care doctor, whoever that may be. And likely they may decide to order some imaging, an ultrasound, as well as a mammogram, a diagnostic mammogram to image the breast tissue and make sure that there isn't anything else going on there.
Yeah. And often that might be unilateral. It would be on one side and not
Correct.
the other.
Yeah.
Right. Yeah. Okay. And then anything else that you think it's important for people to know breast health wise as people in their lactating journeys, or just in general, that you would like to?
I think one of them we already talked about is the breast self-awareness, just being aware of your breast and what's normal for you and any changes that might come up, and making sure that you talk to your doctor about those. But also the recommendations are now that you should be assessed for your risk of developing breast cancer by the age to 25 to 30. So feeling empowered to have those conversations and ask questions with your doctor even that early on. And that goes back to the whole continuum that we were talking about of just breast health and breast awareness in general. So that's an important takeaway. And then also that the recommendation is to start screening mammography at the age of 40. For women of average risk, that changes for women that are at higher risk, but that's why it's important to have those conversations earlier on about your risk assessment, because you may need to actually start screening for breast cancer earlier.
And who puts out those recommendations?
There's many professional organizations, the American College of Radiology, the Society of Breast Imaging, the American Cancer Society. I could go on, but some of them contradict each other a little bit. So I could go into detail with that, but I won't. For these purposes, the important takeaways are that they all agree that the most life-saving happens when we start screening for breast cancer with mammography at the age of 40.
Wow, I'm 42 and I've never been screened.
There you go.
I need to make an appointment. Oh man, just add it to the list of things
I know.
age.
The things we do.
I know. Yeah, it's so important.
Yeah.
Okay.
Great.
So we know that one of the benefits to breastfeeding is that long-term it reduces the risk of breast cancer.
Mm-hmm.
Do you know why that is?
Yeah, that's a really great question. The reason is because through pregnancy and breastfeeding, those are two significant amounts of time that the breast tissue is not going to be exposed to estrogen.
Oh, so it's the exposure to estrogen long term.
Yeah.
And I've read a lot of things about that, how the reason why we have so many more diseases that are recurrent now is that we have so fewer pregnancies than we did, which is great. We don't have to care for 10 children, but also it increases our risk of some diseases. And so it's interesting that breastfeeding can decrease our risk of things like breast cancer.
Yes. Yeah. Well, the longer you,
Statistically.
yes. Yeah. The longer you breastfeed and the more amount of times you breastfeed statistically could decrease your risk. Yeah.
But there are plenty of people who breastfeed and also still have breast cancer, and doing the proper screening can make sure that you catch it early enough.
Exactly.
Right?
Yep.
Oh my gosh, Courtney, this has been so enlightening. Thank you so much for sharing your expertise.
Of course. Thank you for having me. I feel like we could have talked forever, but
I know. Actually, I have one more question because you do both ultrasound imaging and X-ray imaging, right?
Yes, correct.
Okay. So have you gotten the opportunity to see ultrasound imaging of babies nursing?
I haven't personally in my professional career, but I know I have seen an MRI of recently, it's circulating on social media, of a baby breastfeeding and watching that milk transfer happen with the swallow. It's pretty amazing. I know it was a specific study done, not necessarily something that would be routinely ordered or even feasible to do on a regular basis, but it is amazing to see. But we don't see that day to day in regular practice. No.
Yeah, I was just wondering if you ever got to do it, given your unique specialty.
Yeah, no, it's an amazing thing, but no.
Okay. Awesome. Thank you again for sharing both your personal story and your expertise, which is so unique. If anyone else out there has this unique specialty, I definitely think that you should reach out to Courtney, because you are peas in a pod for sure,
Yes.
because this is such a unique set of skills. Do you want to share your professional contacts where people can reach out to you?
Yeah, so I have a website. It's thebreastgirl.com, and I also am the Breast Girl on Instagram, so can feel free to connect. I would love to connect, and you can email me as well.
Great. Thanks so much.
Thank you.
One of the amazing things about feeding our babies from our own bodies is that we do get this familiarity with our bodies that we did not have before. I wonder if you can name whether your breasts are more fatty or more glandular. And remember, this has nothing to do with size. So if you feel around on your own body, what are you noticing? I hope that everyone feels inspired to get to know their bodies a little bit more and feels proud of themselves for any amount of human milk feeding you have done to reduce your risk of breast cancer. And I hope that you reach out to Courtney, that you connect with her on social media, and that you follow her advice and take good care and make sure that you make those appointments that you might have neglected. I know I'm going to. And if it is so hard to think about making appointments for yourself added to all of your family's appointments, remember that you can go to feastandfettle.com and get $30 off your first week's order of home-cooked meals delivered right to your door. That way, if you need to add in some appointments in the evening or in the late afternoon, you don't have to rush home and then figure out what to put on the table for dinner. This is for anybody living in Massachusetts, Connecticut, Maine, Rhode Island, or New Hampshire. Check it out and let me know what you think. Bye.